It is very important to take notes during the clinicals. Clinicals is a continuation of teaching and learning process, and we will have our teachers there. The techs who work there, they have things to teach us, but at the same time, different techs do things differently. So we need to be on top of things, to keep track of things, make sure that we're professional. We do not bother busy people to asking the explanation again and again on the same thing. It's disrespectful and it should not be done. With this notebook will help us. We'll just write it down once and for all and review it anytime it's needed. Also, in the notebook, I'm a visual person. I would love to visualize the information, to draw planes, to draw slices, anatomy, and notebook is really helpful there. Also, we have diagnosis, but different radiologists want different sequences for the same diagnosis. So that can be challenging, but not really if we write it down and we know who we're dealing with and what needs to be done at that point. There are dozens of different protocols to take notes of, and notebook, again, the best friend here. Also, we have very rare exams that we will not be seeing on a regular basis. So at that point, it is necessary to still remember every details of those. So if we have it written down, we can go anytime we want back and review the information. In MRI, we identify three major planes: sagittal, coronal, and axial. Sagittal, it's a visual cut of the body, vertical cut that separates left part of the body from the right part of the body. Also, we have axial. Axial is a horizontal plane that separates top from bottom, meaning superior from inferior. And also we have coronal plane that also vertical, but it separates front from back. So anterior from posterior. It is important for MRI protocols to involve different planes in the protocol because it will give the best image ever, the best information ever to the doctor. They can see the abnormality from different angles, from different sides, like 3D image that makes all the difference. For example, for the surgeon, then he removes the tumor, or for the doctors that have to come up with the best treatment, and this way they have very clear picture what's going on inside of the person's body. What are the MRI protocols? MRI protocols, they're like shopping list of sequences that already designed for specific pathology and specific diagnosis. Why MRI protocols are used is for pulling out the specific anomaly out of the patient body. So this would be the precise, exact information that's already working and is needed by physicians. We use protocols because they're already in place. They're well organized, they're tested, and they're working great. We know that every system interface is different, but we still always will be able to pull out the list of protocols no matter which kind of system it is. Also, each facility can have their own set of protocols. I myself would select protocol from the list. And it is very important to run protocol from the beginning to the end without skipping any parts, any sequences. In protocol, we also notice the scan planes that listed for each sequence. Before running the sequence, we have to plan the planes with exact coverage and angles.